Welcome back to Med School Radio. This is Simon in Tokyo, and we are looking at the USMLE 2013 sample questions, and thank you to benwhite.com for the answer. A 37-year-old man comes to the physician because of a 6-month history of chest pain that occurs when he swallows food. He has had a 9-kilogram weight loss during this period. He has not had heartburn or increased sensitivity in his hands to cold temperatures. He is 178 centimeters tall, or 5'10", and now weighs 59 kilograms, or 130 pounds. BMI is 19. Physical examination shows no abnormalities. A barium swallow shows esophageal dilation, and manometry shows a high resting pressure at the lower esophageal sphincter. There is little or no decrease in pressure associated with swallowing. Which of the following is the most likely diagnosis? Is it A, achalasia, B, esophagitis, C, gastric ulcer, D, gastroesophageal reflux disease, E, hiatal hernia, or F, systemic sclerosis or sclerodoma? The answer here is A, achalasia. Esophageal dilation that tapers at a non-relaxing lower esophageal sphincter, the so-called bird's beak appearance, is classic achalasia.